Good morning, everyone, and thank you so much for joining the Column EDC Coffee Chat, Coffee with Colleen. We are really excited to have our partner from Olympic Community Health, Miranda Berger, join us today. She is going to be talking about what Olympic Community Health is and what they do in our community. And so just a few housekeeping items before we allow her to kick things off. If you'll put your Zoom on mute so we don't inadvertently pick up background noise, or I will do that for you. And then also, if you have any questions, you can raise your hand and ask the question yourself, or I will read your question if you just want to put that in the chat. So with that, I am going to pass it off to Miranda. And thanks so much, Miranda, for joining us today.
Good morning. Thank you so much for having me, Colleen and Mitch. I really appreciate the invitation and excited to share more about the work of Olympic Community of Health and some exciting initiatives that we have coming soon. So I'm going to share, I just have a few slides I wanted to share that I think will help facilitate some discussion today. As I go, please feel free to just pop off mute and interrupt me if you have a question or a comment. I won't be able to see the chat, but I know Colleen said she would help manage that for us. So super open to discussion as I go through these slides, and plenty of time afterwards as well. Like Colleen introduced, I'm Miranda Berger. I'm the Director of Programs with Olympic Community of Health, and I have been working with Olympic Community of Health for the past 6 years. I'm joining you virtually today from my house in Sequim. I'm originally from Kitsap County, was born and raised down in Kitsap County, and moved to Sequim with my husband in 2018, bought my first house here, have worked here in the community, and am now raising my children here. So I have a deep love for Clallam County, and I'm part of this community as well. A little bit about Olympic Community of Health, some background. Olympic Community of Health, or OCH, is the acronym you might hear us go by, is a nonprofit, and we serve the Olympic region, which includes Clallam, Jefferson, and Kitsap counties, as well as the 7 sovereign tribal nations within this region. And OCH was formed back in 2017, and we bring partners together from a variety of backgrounds, disciplines, perspectives, and experiences. And our purpose is really to solve health issues through collaborative action. OCH is one of 9 sister organizations across Washington state, and we are called Accountable Communities of Health. And we were originally established as a part of the Healthcare Authority's work under what's called an 1115 waiver, which is a waiver from the Centers for Medicaid and Medicare Services to implement Medicaid programs in more creative ways. So basically it gives Washington state permission to color outside the lines a little bit in how we deliver services for the Medicaid population. Like I said, we work in Clallam, Jefferson, and Kitsap counties, and we really, our goal is to improve individual and population health. We serve as a supportive backbone organization. So I mentioned we're a nonprofit, but we're a little bit unique in that we don't provide direct services to the community like a typical nonprofit might. Rather, we partner with those folks who are providing those direct services to bring them together in creative and innovative ways to help strengthen how we're caring for our communities. Our mission is to tackle health issues that no single sector or tribe can tackle alone. So really collaborative action is really baked into what we do. In 2021, the Olympic Community of Health Board of Directors adopted a new strategic plan, and through collaborative efforts with our partners, we identified a broad overarching goal, which is to improve individual and population health and advance equity by addressing the determinants of health. This is a nice summary of our strategic plan. And once I'm done sharing my screen, I can pop a link in the chat to our strategic plan on our website if you wanted to look at the whole thing. Each element of this plan was informed and inspired directly by the community that we set out to serve. So we really believe the best approach to fostering health is to look to our community, to elevate voices of those who are most impacted, to maximize our local strengths through collaboration, and to also bring in some incentives, mostly through funding opportunities, to foster creative solutions to local problems. You can see here that our key focus areas are around housing, access to care, and that includes the full
Your
spectrum of care.
presentation isn't showing.
Sorry, just a minute. So I think that was who, Darlene, I think you just said something. What was
Yes,
it?
I don't see her presentation.
Oh, I do.
Oh, okay. Must
Does
be me.
everybody else see her presentation?
Yes.
Yeah.
Yes.
Yes.
Sorry, I don't know what happened.
Might just be a different screen, Darlene. Probably toggling around.
Okay, sorry about that. Go ahead, Miranda.
That's all right. As I hope most of you can see on the screen, our key focus areas are around housing, access to care. And when I say access to care, we really mean the full spectrum of care. So looking at primary care, mental health, substance use disorder care and treatment, dental care, and then those social services that provide care as well. We also have a focus area around meeting individual needs timely, easily, and compassionately, and addressing substance use disorder is another key focus area. We approach this vision of creating a healthier, more equitable region by leaning into these roles as a catalyst for change. We work on advocacy and education and try to organize partners to leverage collective regional efforts. We are mostly seen amongst our partners as a community connector, so bringing partners together in creative ways, and then also serve a role as a seed planter where we allocate dollars and resources through a variety of different projects and initiatives. Like a lot of different places, the Olympic region, we know, faces a series of really complicated health issues, and trying to address these independently or on our own is really hard. Everyone has limited resources, limited time, limited funding. They often have very niche skill sets. And so this can often feel like we're paddling against the current. So we have heard that in order to make a lasting impact, we really need a unified collective approach. And we really need to work together with our neighbors to start to paddle in the same direction. And that is what leads us to this theme in our work, which is We're Stronger Together. I mentioned earlier in our goal that we have in our goal to address the determinants of health. And when I say determinants of health, that really means those conditions in which people are born, grow, live, and age, and those can both positively and negatively influence someone's health and well-being. So think of things like whether or not you had a parent that went to school. That can be a determinant of your health, which could both positively or negatively impact your health. The quality and affordability of your housing is a determinant of health that could be both positive or negative. And we know that most of the work to address these determinants of health are happening outside of our healthcare systems and really require a broad community-based response. There's over 2 decades of research now that demonstrates that there are negative impacts when we have adverse social conditions. So things like poverty, job insecurity, housing instability, poor housing quality, environmental pollutants, food insecurity, a lack of educational support, social isolation, chronic stress, these have all been shown to impact our health. And recently, there's research that demonstrates the promise of social care to deliver better outcomes at a lower cost of care. So we see across the nation, people are starting to make investments in things like housing, income support, nutrition, education, and care coordination. And these are proving to be effective strategies to improve the health of communities and to reduce the total cost of care. You may have heard, like in the news or in articles, that the United States has spends the most per capita on healthcare expenses in among modern nations, and we also have some of the poorest health outcomes. So we're really not utilizing those costs in a way that is effective. So a more coordinated and collaborative system will help facilitate greater success towards this vision of healthy people and thriving communities.
So Miranda, I have a question about that. If you can go back one second. So it seems to me that the health behaviors, tobacco use, diet and exercise, alcohol use, sexual activity, those seem so connected with education, job status, and family support and income, that if you have those socioeconomic factors that are positive, that it just kind of naturally flows into the health behaviors. Is that a fair assessment?
Yeah, absolutely. I think the biggest takeaway from this slide here is that when we think about becoming healthy or well, a lot of times we look to clinical spaces, like you should go to your primary care doctor. And I think the biggest takeaway here is that really that's only contributing to about 20% of what makes somebody healthy or not. And not to say it's not important, but there's only so much that can be done within the four walls of an office to address somebody's health. And really it's this other 80%, and these are so, like you said, interconnected. It's not really valuable to try to piece apart, what's because of low income or what's because of health behavior, because we see in data that they're so interwoven and highly correlated.
Mm-hmm. Yeah. Okay. Yeah. And clearly the income would affect your physical environment as well. So yeah.
Absolutely.
Okay. Thanks.
So to this end, I'm really excited to in the next couple of slides, I only have a few more, but to share a little more in depth about a new initiative that Olympic Community of Health is working on. So like I mentioned, we're one of 9 sister organizations across the state. And together with those sister organizations, we are working with key funders and partners in our regions to establish a statewide network of what is called community care hubs. So a community care hub is a model that has been tested in other parts of the country and has been proven effective in responding to and addressing key social needs and reducing barriers to health and well-being. But this is really exciting because Washington State will be the first state in the nation to take a statewide approach to this work. So there's examples of this in individual communities across the nation, but no one has done this on a statewide scale. So a community care hub is a community-centered entity that supports a network of partners providing services and resources to address social needs. It centralizes the administrative functions and the infrastructure to do that work, and it has relationships with and understands the capacities of local organizations and fosters that cross-sector collaboration. So OCH will serve as the community care hub for Clallam, Jefferson, and Kitsap counties, and our hub is called Olympic Connect. So right now we're working closely with funders to finalize details of this work. We just signed our contract with the Health Care Authority this morning. We are also getting ready to sign a contract with the Department of Health here in the next week or two, and we also have been pursuing some other grant opportunities with local partners. And we're working really closely with those funders to finalize details and expect the hub to launch in early 2025. So a question that we get a lot when we start to talk about this work is, like, we're already doing this. People are already addressing social needs. And we know that. Partners in our region are super dedicated, have been working tirelessly and diligently for many, many years to address social needs. And when I say social needs, I mean like connecting people to transportation, addressing food needs, getting people housed or trying to improve someone's housing quality, helping somebody get a job, helping somebody go back to school. Like that, those are what we mean when we say social needs. And partners have been doing this for a long, long time. However, you might have witnessed in your own work or in your personal experiences living in this community that those efforts are really, really siloed. And there isn't a central place where we can effectively track and address gaps in available resources. The organizations who are providing these services and resources are having to chase grants, often don't have sustainable funding to meet the need. And we also don't have a system in place to be able to track health outcomes to see how these efforts are paying off. There's not a system in which we can say, you know, we house this many people and now they're healthier as a result. So that's what makes this a little bit different and unique from what is already happening. Is it doesn't remove or duplicate the efforts that partners are already doing around this work. Rather, it creates a system in which they can more effectively work together. We know that we're going to learn as we go. We don't expect that when this launches in 2025, it's going to be perfect. Part of this plan is to refine and reiterate with our partners as we go. We do see that this has potential to add value to the region through strengthening how we deliver those social services, rolling up the individual organization or partner data into a bigger picture view, which will allow us to better understand where are the resources and service gaps in our communities, and then better demonstrate our successes and challenges to funders and legislators and policymakers. This approach really values the expertise of our community and social service partners and really allows them to focus on the work that they do best, which is providing the service, and removes that infrastructure and sustainable funding gap and challenge that they're experiencing. This will also help facilitate some shared learning across the network to support, develop, and spread the innovations and partner-led solutions that are working well already. It elevates the community of voice and will also provide some technical assistance and administrative support. And then for our clinical partners, this really has the potential to reduce what's referred to as social admissions that often go unreimbursed. So this could include things like social bed days or delayed discharges from higher levels of care. So for example, here in Colleen County, a big barrier that Olympic Medical Center faces at the hospital is they have patients who are stuck in the hospital because they don't have a safe or appropriate place to discharge them to. So they don't really need to be in the hospital, but there's not a long-term care facility or an adult family home or family members or appropriate housing that they can send someone to, and then it backs up that precious resource. So in the long term, we're aiming to simplify and streamline the way that social care is provided in our communities. And this ensures that individual needs get met timely, easily, and compassionately. And ultimately, this will help improve health outcomes, reduce that total cost of care, and advance equity throughout the region. So those were the slides I have. I'm going to leave this up for just a few moments so that if you wanted, or actually you won't be able to click on it. So what I'll do is I'll pop these links in the chat, and I think Mitch also has my slides, so you're welcome to send these out as a follow-up. But really, I didn't want to show slides for too long because I mostly wanted to hear from you all, like if this resonates or if you have questions or comments or concerns. I would love to hear all of those.
Okay, great. So I'm not seeing a lot in the chat. And I know we've got some people from the healthcare industry on, and is there anything that anybody wants to add to what Miranda has shared? And Miranda put the website in the chat. Thank you. Have you, so since the program's been really up and running, what kind of impacts have you seen thus far?
So we're not up and running yet. So we are not accepting referrals yet. It's like I said, I expect to launch in early 2025. So right now the work that we're doing is to get ready. So we have a regional advisory group made up of local partners that are helping us with that planning and design work. We're working on some like some branding and imagery and communication guides so that we can like effectively be promoting this and communicating this out to both our partners and lay community members. And then there's also some shared technology that this will bring, which definitely meets a need that we've heard. And so we're getting that set up and ready. So partners, we're also setting up some funding opportunities. So over the next several months, there'll just be a continuous rollout of updates as we get ready to start taking referrals.
So Priya, you wanted to speak? Hi.
Yeah, hi, good morning. Thanks, Miranda. That was really interesting. I just have a question with regards to caregiving and how much focus there is in any of these initiatives in addressing the caregiving crisis, because it truly is a major issue across the country, across internationally probably, but here we see it at hospice in that, you know, caregivers for people in health crisis is a big, big concern, and there aren't sufficient numbers of paid caregivers, much less family caregivers.
Yeah, so one thing I did not talk about because there's not clear timelines yet from the Healthcare Authority, but this initiative from the state level brings a new slate of Medicaid benefits. So and Washington has the opportunity to pilot actually having Medicaid pay for addressing social needs. So there's I think there's 10 new benefits that are rolling out as a part of this work, but the Healthcare Authority hasn't communicated when each of those will go live. But I do know one of those benefits is caregiver respite as one strategy to try to address the high needs and high desperation that's being seen in those communities. What the work that OCH is doing will definitely connect people who are eligible for that service to that benefit when it becomes available. This won't provide the additional caregivers here within our community necessarily, but one of the things we're doing, because it's mostly focused on case management is why I say that. However, we do have infrastructure dollars to try to bolster the top needed services and resource gaps that we see in our community. So we've been working with our partners to identify like what are those top things, because we know we can't address everything because there is limited funding and we really want to make a deep impact. So there'll be some funding opportunities soon where partners will be able to tell us, you know, here's the top social needs, and then what do we want to do to try to expand eligibility for existing services or create a new service that doesn't currently exist in our community.
I had a question, Miranda.
Yeah.
I was curious. So the Olympic Connect is going to cover 3 counties, correct? The Clallam,
Yes.
Jefferson, and Kitsap. So that your sister organizations or partner organizations, are they also going to be a community care hub and cover
Yes.
various counties? Okay.
Yes. So the Healthcare Authority and Department of Health are contracting with all of the accountable communities of health, and there are 9 in Washington state. So the state is split up into regions. They largely follow like the old RSN regions, if you're familiar with those. So we call it the Olympic region. Sometimes you'll hear it called the Salish region. some of them are single counties. If they're bigger, like King County, that's the region. Pierce County,
Right.
that's the region. But then like our sister organization covering Mason, Thurston, and Grays is called Choice. So, and we're working closely with them so that there's balancing that statewide alignment piece, so that we've talked about this, like we want it to be like when you go into a hospital, like you're in a hospital, but each hospital is different to meet the needs of the community, and having a similar approach to the hubs where we have some statewide alignment. So when you're in the hub, you know what that is across the state, but allowing lots of space for us to make this work for our local communities, because our needs here are not the same as King County.
Right. Thank you. Yeah, that's what I was curious about. I mean, those larger counties, they kind of need their own hub, so that makes sense how it's split up. Cool. Thank you.
So I see, Steve, you turned your camera on. Is there something you wanted to share? I know that you sit on the what is it, healthcare committee at the state level?
Yeah, healthcare and wellness. You're very observant, Colleen, as we all know. Yeah, Miranda, could you speak a little bit to the funding? Does funding come through you? I mean, the RSNs, it used to be, the behavioral health funding used to come through the RSNs and it'd be distributed through, to the different counties. And now that you sort of are replacing that, or how does the funding stream work through HCA to you, to the agencies that are part of your hub or part of your service area?
Yeah, so I will answer your question. I just want to clarify, when I mentioned the RSN, I just meant the region. So OCH is very, very separate from the old RSN. It doesn't replace it. What was replacing the RSN is called the Salish Behavioral Health Administrative Services Organization, and they are still very much around. So we haven't replaced that work, and funding still moves through them to behavioral health providers. So our funding mechanism, we have, like I mentioned, 2 statewide funding streams. One comes through the Healthcare Authority, and the source of those funds is from the federal government through Centers for Medicaid and Medicare Services. So the way that money flows is money comes to the state through the Healthcare Authority, and then the Healthcare Authority, through complicated models and equations, distributes that to each region. I can say that our region is the smallest region, and they calculate that by the number of Medicaid lives. So our region has about 84,000 people on Medicaid, give or take, at any given time. And that is the smallest proportion of Medicaid lives across the state. So we get the least amount of funding from our compared to our sister organizations. And then we will receive money from the Department of Health as well, and that has also has some federal dollar sourcing. And then we recently worked with local partners to obtain a regional challenge grant, and then I know that have been partnering with partners on a forthcoming recompete grant. And so this is like a braided funding model. So all those different funding streams come into Olympic Community of Health, and then we work to distribute those out to partners. So that will happen through a variety of different ways. There will be actual dollars for partners we contract with to do the case management of folks. So there are people who already do case management very, very well in our communities. We don't feel the need to replace that. Rather, we will provide the sustainable funding source to employ those folks and do that good work, and bring them into the hub for more collaboration and efficiency. And then there will also be what we're kind of categorizing as like infrastructure dollars. So those will be the dollars that go out to partners who want to, say, expand a community resource or service, or create a new community resource or service to meet a need. Or a big piece of this is also supporting the workforce who does this work. So sometimes that looks like we contract with a local partner to provide a training to the workforce at no cost, or partners want to send their folks to some trainings, but they can't afford to do that. And so we provide funding in order to allow them to do that.
So if I could, so you're a convener, right? So you bring various service providers together in this holistic approach. And then you also distribute dollars to service providers. You yourself are not a service provider. And then the decision-making process there is there's a board or there's a council of various folks, various service providers and other folks that are interested in this holistic approach.
Yes, yes. So we have a board of directors that directs, like the big decisions of our organization, including funding, and that's made up of a lot of local partners. We're a small, even though we cover the 3 counties, it's a small region. So everyone wears lots of different hats. And then we also have this advisory group, which is made up of some of our board members, but a lot of other faces as well, but all from our local partnering organizations and agencies and tribes.
And if I could follow up, Colleen and Miranda, and do you have a sense of what kind of dollars we're talking about that would be coming to Olympic Community Health?
I don't off the top of my head, and because we're still signing contracts, like I hesitate to put like a dollar. I can say like not millions and not tens of millions, if that's an okay range to say.
Yeah, I guess that's directionally correct, maybe, but yeah, okay. I mean, it is. It is an interesting model, and the holistic approach is I think the right approach. It's just how does the funding get to where it needs to be, and how those decisions are made. This is, I think, interesting. So, thanks for your work.
Yeah, and the funding opportunities that are coming out over the next several months, we're being very clear, like this is the first round of funding. There will be funding every year under this initiative, which is it's a 5-year statewide initiative, and we're building it to with the goal very much of being sustainable post the 5 years. But every year will bring new funding. So like I said, we're not going to address all of the social needs in the first funding opportunity. And we know our partners are going to tell us like, great, and like this is where it really needs to go next year.
Great, thank you.
Yeah, so also Paul had a really good comment in the chat. He says, kudos to you for taking a holistic approach to community health. Can you explain the role that housing will play in this initiative?
Yeah, so I would say through anecdotal evidence, which probably wouldn't surprise anybody, and also when we start to look at, there's not great data yet, which is one of the goals of this initiative to get better, more reliable data. But when you look at the available data, it's very clear that housing is one of the top social needs, probably not just for our region, but definitely here locally. It's a huge struggle, and there's different categories of housing. Like when we just say housing, often that feels like way too big for our partners. Like we can't solve housing, and then there's like inclination to kind of throw your hands up about it. So we've really taken an approach of trying to dig deeper of like, well, what about housing are the top needs? And so our partners have helped us prioritize transitional housing. So trying to find solutions to move people out of those higher levels of care. And so one example of our work historically to address that is we've provided some funding in the past to support the Medical Respite Center. That's a partnership between Serenity House and the Clallam County Health and Human Services. Medical respite is also going to be one of those new Medicaid benefits. So that can be a reimbursable service for eligible people when that comes online. Another top housing need that comes up time and time again is workforce housing. So there's a health serving workforce crisis or fast approaching crisis here locally. It's really hard to recruit people to come and work in our communities. It's hard to then retain those folks because then we get them here and then they can't find a place to live that's affordable. So that's another top priority, and there's different solutions we've worked on towards that. There's a lot of like grow your own initiatives that are happening. I know Peninsula College is doing a lot to partner with local healthcare facilities to help bolster programs that are going to support the most needed workforce gaps. But that's like another top area we've been focusing on. So there'll be new Medicaid benefits that help. There's several actually that address housing in addition to the medical respite. We anticipate putting some funding out the door to help partners expand housing services. And then the big piece of this is that case management. So having a more streamlined central way in which people can help connect to resources and more clearly identify where is the gap happening for people who are looking for housing, to then advocate up to the state for solutions.
Great. Does anyone have any further questions for Miranda? I think it's been a really important discussion. And yeah, I learned through this whole recompete grant writing process about all of these different programs that are out there that I thought I was pretty aware of, and found out, yeah, there's just so many really specific programs that are maybe for only 18 to 24-year-olds, or people that, you know, have this level of income, or people that are college students, or, you know, so it's just not a broad program that could help anyone. It's always got some type of metrics around it, so that if you don't meet those metrics, you're not eligible. But there may be another program right down the road that would have supported those folks. So I think having that navigator piece is so incredibly important, because as long as they're fully aware of all the different programs, and boy, we have so many nonprofits that just provide services, and that aren't government funded and maybe don't have the really strict metrics around eligibility. So I don't know that everybody's really aware of that. So I see, Jim, you have your hand raised. Go right ahead.
Thank you very much. Zoom crashed on my computer here, so had a little gap. You may have covered this question already. Steve, my good friend Steve Theringer anticipated my question about funding, and you answered that. Could you go into a little bit what goals and metrics come with that funding? Because state funds and federal funds very often have here's what you will do and here's how you will report your success or otherwise in meeting these particular goals. Can you talk about that a little bit if you haven't addressed that particular part of the funding streams that you have?
Yeah, so there are a set of statewide measures that we will be asked to report on, and part of our work now is to build the systems in order to be able to do that. And a lot of that focuses specifically on the case management. So how much, kind of, you could categorize those. I think there's like 20 or 30 different measures. But like, how much did we do? So like, how many people are we serving? How many connections are being made? How many people are we, providing funding to? And then there's another set of measures of how well did we do that? So those would be things like, okay, you had 5,000 people come into the hub referred for service, but like, how many of those people like actually had their need met, or were served, or were referred or connected to a resource? And then the third category of those measures would be, and is anyone better off? And that's where we start to look at the health outcomes data. We also are going to be looking at like client satisfaction as well as partner satisfaction rates. So burnout is a really big challenge experienced by the workforce who's doing this work of connecting people to resources. So looking at their satisfaction, their longevity, Are there, training needs and supports being met? And then, of course, the client satisfaction and like, would they refer somebody to receive this service, or would they come back, or do they feel like they got the appropriate help they needed? And then we're working with our advisory group and our board to identify if there's additional measures that are important for us locally to be tracking and measuring. The shared technology will also allow us to see like what are the top searched social resources, where and then where are people seeking a resource, but we cannot connect them to that resource because it just doesn't exist or because it was full. So those are kind of the key data points that we're toying with. The funding streams will need to report on those, but it's not a performance-based funding stream at this time. So the performance on those measures doesn't impact how much funding will come to the region, at least initially.
Right. Thank you.
Hey, Colleen, can I pop in?
Please.
Hi, Miranda, this is Rebecca Miller. Speaking of burnout, after founding OPHCC, Olympic Peninsula Healthy Communities Coalition, Marco Zayas and Monica have taken on emeritus roles. So I'm going to try to chair that committee as we try to get it rolling again. You have been an incredible support to us. And I think the magic in that is that we try to bring everybody to the table and just let them talk about what they are doing. And we're going out to Forks for our September meeting. And we were actually just last night in a board meeting talking about, is there anybody that could facilitate a meeting that would kind of spur new partnerships, thinking, kind of a brainstorming, but there are so many connections that happen in that meeting. And I see Cindy Kelly here. She's certainly comes to our meetings quite often. So I was just wondering if you know of somebody that might be able to do something like that.
I'm sure if I had like a couple of minutes to think about it, somebody would come to mind. So if you wanted to send me an email, Rebecca, I'd be happy to chat more as a follow-up and see if I can help think of a solution.
I think we're doing what you're doing, just kind of on the ground level out here. And it has, because of your support, been incredibly successful.
Yeah, I popped my email in the chat, so happy to chat more.
Yeah. Okay. Thank
Hey,
you.
Colleen, this is the
go
other
ahead.
Colleen.
Yeah.
I just had a quick question, and I'm sorry if you covered this, Miranda. Fascinating. What will be the process, and how long will it take for people who partner with you to apply for the funding? Like once they apply, what will the process be? And then once you receive it, how long for it to be reviewed and either, accepted or declined?
Yeah, so I anticipate there'll be at least 2, maybe 3 funding opportunities between now and the end of the year to support different work related to this. And our processes really prioritize having it be as low burdensome as possible for our partners. We have a pretty positive track record with our partners of putting both flexible funding and low barrier funding out the door. So that's a big priority. Typically, like our turnaround time from putting a funding opportunity out the door to contracting is like 90 days. So allowing about putting it out the door, allowing about 30 days for folks to apply, giving us about a month to review, make decisions, and then moving into contracting and decisions. So it's fairly quick.
That's awesome. Thank you.
John Temple asked, we have 84,000 on Medicaid. What's our total population as compared to King County population and their Medicare rates? So I know between Kitsap, Flallam, and Jefferson, we have about 390,000 population in total. And so 84,000 are on Medicaid. So that's about 22%. is King County's around 22% as well, or is it higher or lower?
Oh, King County is way, way higher. So I was trying to do some quick back of the napkin math, but I can admit that's not my strong suit. But if somebody else is more equipped, 84,000 is about 4% of the total Medicaid population in Washington state. And I don't have the breakdowns for every single region, but yes, King County is way, way, way higher.
By percentage, or obviously just numbers, but so by percentage, they have a higher rate of Medicaid participants, enrollees?
That I don't have in my brain. We have I'm going to pop another link in the chat. We have a handy tool on our website called Connecting to Data, where we break down some of our regional data a little bit. And I was going to see on there, and we update this annually. Now my computer's being slow, but there is some Medicaid data on here, and I just can't get it to load. Thank you. You're challenging me to know what's I keep in my brain and what I have to go back and look for.
Okay, well, it is a great website, and we'd love to have you back in a year or so, and hear what some of the successes have been and what you've learned from the whole process. And it's hard work, it's complicated work, but it's so important to be able to help our overall community members. So
thank you so much for having me.
Yeah, absolutely. Really appreciate you joining us. And so next week we have Roy Mann and Dialogue Design are going to be joining. They finished up an ADU manufacturing study. So really, I think a large part of the discussion next week will be about the potential of ADUs in our communities in Clallam County, and really what's been fascinating to hear about is ADU condoization that's happening across Seattle. And, is that a potential housing solution for some parcels and members in our community? So, all right. Well, with that, everyone, thank you so much for joining us, and we will see you next week. I hope you can join us next week as well. Thanks so much again, Miranda. Have a great day, everyone. Bye.